Well, I want to welcome someone who I'm privileged to call a friend. He's the director of the National Institute of Health, Dr. Jay Bhattacharya. He was a longstanding decorated professor at Stanford University at the medical school. He's a physician, he's an epidemiologist. He famously was called in an email chain that became public a fringe epidemiologist who needed to be subjected to a devastating takedown. This is what the previous administration thought of him. Now he's the head of the National Institute of Health. Poetic. That's the best way I can describe it. He is a great professional, a great person, and a wonderful physician. Jay Bhattacharya. Jay, thank you for joining me.
Thank you for having me on, Dr. Bruce. So nice to see you.
So, I got a couple things. First of all, how are you? Is everything good?
I'm doing okay. Yeah.
Okay.
It's still I'm still getting used to the new office. So you can see my books are not all moved in yet. I'm working on it. But we've done a lot of great things at the NIH in just a short time, and a lot more to come. We're going to help make America healthy again. That just makes my life much happier.
You know, and it's interesting. I spoke to you once since you've been installed, and I thought you were going to tell me that you're frustrated and things impossible, but it was quite the opposite. You were inspired and you thought about all the things you could do. Are you still as inspired?
I'm still inspired, absolutely, Drew. I mean, there's it's government, so it's very different from academics. The academics have its own bureaucracy. I'm still getting used to the government bureaucracies, but it turns out there's a lot of great people who share the mission. I mean, we're about using the resources of the National Institute of Health to do research that actually addresses the health needs of the American people.
Yeah.
I mean, who could not be inspired doing that?
Exactly. I saw you active on social media just recently, maybe even a few minutes ago, and I want to read something to you, if you don't mind, that you were responding to. It's from the American Medical Association. May I proceed? Do you mind?
Absolutely.
Okay. Here's what it had to say on X. It's disappointing that the HHS is shifting rationale for ending certain mRNA vaccine research. NIH Director Dr. Bhattacharya separated the government's public role from its duty to foster pro-science public consensus. This sounds like gobbledygook so far. Public trust is vital, but urging Americans to disregard science and their physicians is a step in the wrong direction. Oh my.
Okay, so let me just set the context real fast for it. Secretary Kennedy did something I thought was quite sensible. We have a whole bunch of contracts to companies to use the mRNA platform, which was used for the COVID vaccines, to essentially for all respiratory viruses, and including more COVID vaccines. Now, the problem is with this is that if you look at, let's just look at a Pew study from last year, 60% of the American public said they were not going to ever take another COVID vaccine with mRNA in it, right? If you look at the numbers now, I mean, it's something like only 1 in 4 Americans are abiding by the CDC's guidance. We have a major problem then, because there is no trust in this vaccine platform. Should we invest in a platform where the public has lost all trust, or should we invest in other technologies that are more promising, like whole virus inactivated vaccines?
Yeah.
That the public actually hasn't lost trust.
Yeah, I completely agree with that. And I was so delighted to hear your response on X, which is essentially that. And people need to understand, you're not preventing research on the mRNA platform. You're just not funding it, research against respiratory viruses, for which personally, it's not even clear we need vaccines, let alone a vaccine that the public has lost trust in.
Yeah, so for instance, I am a strong believer in research for using the mRNA platform for cancer.
Yes, right, for sure.
I mean,
for cancer, it'll be great.
Promising things. And there, the whole sort of calculation is different. First, you haven't lost public trust in it. Second, you're not asking everyone at scale to take healthy people to take the thing. You're saying people who are like sick with cancer, severe cancer, this is the best, if the research pans out, the best alternative. It's a very, very different calculation. I'm pro-science because I love new ideas that translate into better health. And if the mRNA platform proves itself to be the right thing, right tool, I'm going to sign on for it for that thing. And for cancer, like I said, it's quite promising. We are funding applications on that at the NIH as we speak. I think that makes sense to me. I've said on the record that I'm committed to making sure that we do good research to address long COVID. I mean, because there's a lot of people that are suffering, and we want to make sure we have good answers for them. But we also need to support research to help the people who are vaccine injured. And we need to make sure that whenever we use a vaccine, when you're giving a vaccine, a product to hundreds of millions of people, even rare side effects will mean lots of people will suffer. We have to make sure that those people get the help they need.
Do you have a sort of either formal or an intuitive notion of how we restore that trust in medicine and science? It's a problem. And I don't blame people for not trusting us. I wouldn't trust us either. But I do have a deep commitment to this profession and the scientific project being something people can trust. How do we get there?
Well, first I share with you that commitment. I mean, I became a doctor because this is completely naive. I know, but I wrote in my application that I wanted to help people, particularly people who had conditions that were very easily treated, but people weren't getting that help. I think that public trust is vital to that. But Drew, it depressed me so much to see the AMA launch an attack on me in this way. If I were ahead of the AMA, what I would be doing is I would do a retrospective and say, here's why we lost our way earlier, and here's what we're doing to fix things. What I'm planning to do, and this is, I'm so grateful to you for giving me a platform to start to do this, is talk to the American people and tell them, look, we're aiming at is improving your health. Scientists and public health people are servants of the people, not lords of the people. I want to talk to people in ways where I say, here's what I know and here's what I don't know. I want to bring people who disagree with me to have conversations with me and others. I want to foster in an academic environment where that kind of honest conversation is the norm. And I want transparency. Like what are our people's funding sources? What does the evidence say on topic after topic, and broaden the expertise that comes to the topic. I think that's the only way how we regain trust, sort of one conversation at a time.
Wonderful. And I would add one more thing personally that I would love to see, which is, and I look for every opportunity to do this as a model for others, is apologize where you made a mistake. I'm sorry, this was wrong. I got this wrong. I've adjusted course. Here's why I thought what I thought. It was wrong, and I apologize. I called Jenny McCarthy into my streaming show, and I said, Jenny, I was not kind to your vaccine position. I didn't give it any thought. I was disrespectful to you as a mom. I don't know if what you saw was true or not, but I was dismissive, and I apologize. That is wrong. We should be listening to each other, and we should take every complaint seriously and not just push things aside because we don't think it's true.
For decades, I've been listening to you. I mean, you're a model of how that kind of. I mean, when we all get things wrong, and especially when we're in public all the time, it's sometimes when we get things wrong, it can have consequences.
Yeah.
We have to own up to them and then move on and say, here's how we're going to try to prevent those us from getting things wrong in the future. To me, the key thing is just discussion with people, like bright people who disagree with me, maybe disagree with me, but we're all share this commitment to evidence, share this commitment to advancing people's health. I want to surround myself with bright people who are there to say, Jay, you're not right this time. I'm not trying to destroy people with this. Just because I get things wrong, I don't want to do devastating takedowns. What I want is to foster conversations rooted in evidence, aimed at helping people improve their lives through better medicine, better advice, better health advice.
The said devastating takedown resulted in the rise of a phoenix, and I love the position you're in. I love what you're saying. I appreciate you so much. I look forward to coming to DC and shaking your hand yet again.
Likewise, dude. Can't wait.
All right, Jay. Thank you, man. Appreciate it.
Bye.
You see why I love that guy? Yes. He was the one they decided they had to subject to a devastating takedown. Crazy. Really wild. More Health Uncensored coming up next.